Bismillahirrahmanirrahim. Assalamu alaikum. In this video, we are going to talk about alpha 2 agonists. And we know there are many alpha 2 agonists: xylazine, detomidine, dexmedetomidine. So, first thing is their general properties that they have. They have analgesia, that is loss of pain perception. They have sedation or like sedative effects, like these are sedatives. Then they cause respiratory depression and have profound cardiac effects. When we talk about their significant cardiac effects, it includes vasoconstriction, hypertension, bradycardia, decreased cardiac output, cardiac arrhythmias, and second degree AV block. So, whenever you will inject these alpha 2 agonists in an animal, you're going to see all of these cardiac effects. Next, what we have is that alpha 2 agonist cause bradycardia that is so common that it does not need any response. The heart rate decreased heart rate will persist and it really requires treatment. For example, in case of horse, when you inject xylazine in it, it will cause bradycardia and second degree AV block and decrease respiratory rate, but it will not needing any treatment. And never ever use antimuscarinic to increase the heart rate in case of bradycardia that is caused by any alpha 2 agonist. We have talked about this thing in detail when we talked in previous lectures of atropine. So we know that basically the pathway through which alpha 2 agonist causes bradycardia is different, and the pathway upon which antimuscarine acts to cause increased heart rate is different. So you are not going to reverse the bradycardia caused by alpha 2 agonist with the antimuscarinic atropine. Atropine will only be used in case of those bradycardias that are vaguely induced. So those are separate conditions where we use atropine in bradycardia, and the bradycardia caused by alpha 2 agonist is a different condition. So do not mix these. Be vigilant on this thing. And you should remember that dexmedetomidine or like any alpha 2 agonist is contraindicated in cardiac patients because it will further cause decreased heart rate, second degree AV block, and it will lead to the death of the animal. So if the animal is having any heart issues, heart diseases, history of heart diseases, so these alpha 2 agonists are contraindicated in those animals. Next, we have talked about this property that xylazine or like any alpha 2 agonist causes sedation, not a proper anesthesia. So we use the alpha 2 agonist with opioids to increase the duration of anesthesia and a proper, profound or balanced anesthesia. For example, butorphanol is mainly used with xylazine, so you can use such combinations. There are some antidotes available for alpha 2 agonists, like dexmedetomidine is reversed by atipimazole, and while reversing, you should use same volume of atipimazole as of dexmedetomidine to reverse it. And yohimbine is the antidote of xylazine. So you can relate basically this property with this, that we have seen that it alpha 2 agonist causes uh, bradycardia, and we cannot use atropine to deal with this bradycardia. So let's suppose you have injected an animal with alpha 2 agonist and it is having bradycardia and it is like going to be fatal. Some in some conditions, like you think as a doctor that no, we need to reverse this or we need to treat this heart rate. So what you will do, rather than using atropine, you will use any antidote. So go for the antidote to deal with that bradycardia if needed, but never use atropine. So these are the antidotes. It will reverse not only the side effects on cardiovascular system rather than but also it will cause animal to wake up, like it will also act as an antidote for the sedation that alpha 2 agonists cause. Next we have is that alpha 2 agonists inhibit the release of norepinephrine at presynaptic alpha 2 receptors both centrally and peripherally. So when you will inject the alpha 2 agonist, norepinephrine secretion will decrease. Also, alpha 2 agonists will stimulate alpha 1 receptors. So they have some of the potency for the alpha 1 receptors too, but mainly they are alpha 2 agonists. Potency of alpha 2 agonists from highest to lowest is given below, and also the ratio of, there should be a comma, ratio of alpha 1 to alpha 2 receptor action is also given, like top to bottom. The potency of alpha 2 agonists decrease. Like you can see, for alpha 2 receptors, detomidine has this much potency, 1620. Romfidine has 340. Detomidine has 260 and xylazine has 160. So top to bottom, the potency of these alpha 2 agonists decreases in this way, like in that descending way. And you should remember that they also have alpha 1 affinity too. So they will act on alpha 1 receptors too. Uh, Next, we have what we have is that cattle and ruminants are more sensitive to xylazine sedative effects. Xylazine sensitivity is such that cattle are more sensitive. Then we have camel. Then we have swine. Swine is most resistant to the sedative effects of the xylazine or alpha 2 agonist, and that's why we use xylazine with some other drug, anesthetic drug, to cause anesthesia in swine. Cattle has 1 by 10th dose of the horse. You should remember that. Decreased dose produces sedation without recumbency. This is a very, very, very important point, that whenever you use xylazine or any alpha 2 agonist to cause sedation in animals before surgery, the animal will stay non-recumbent. Like animal will keep on standing and having sedation and analgesia. So you will perform surgery in such animal while standing. So this anesthetic drug does not provide you can say recumbency, and it is a good thing. Like when you deal with animal like cattle, which has a very big rumen, and you have to perform any rumenectomy or any such surgery, so you feel difficult to deal with these animal when they are recumbent. So it's better that they stay standing, and you can perform your surgery easily with analgesia. So alpha 2 agonists are good choice over there. Uh, Although the board exams like BCSE do not require, like they do not ask dose rates in exam, but I have like mentioned the dose rates of xylazine over here, because you can understand this point, that cattle has 1 by 10th dose of a horse. So as far as any bird is concerned, like birds have body weight range 0.2 to 2 kg. They have 10 mg per kg. Then we have dog that might range between 10 to 40 kg, has dose rate of 1 to 2 mg per kg. Horses have 0.1 to 1 mg per kg dose rate, and ruminant have 0.01 to 0.03 mg per kg dose rate. So you can see the difference is of 1 by 10. So that is about the dose rate of xylazine. So this was all about the alpha 2 agonist. I hope you have understood the lecture. Thank you so much.